Okay, so thank you for everyone for joining us today. Almost as if you had a choice, and maybe the getting out of here is a good thing. We can move things along today. We'll see. So I'm going to spend a little bit of time with us talking about some introductions, some recognition, what's going on from a system perspective, and then this topic of what's ahead. So I do want to have some participation from the audience at a couple of points here. First thing I want to do is do some introductions for some new leaders who may or may not be in the room. So as I call you out, if you wouldn't mind standing up, and we'll go from there. Maybe we'll hold applause till the end. So do we have Anna Austin, 3 Layfield Clinical Supervisor here? There we go, Anna. We're following instructions so well. It's all right. Go ahead and clap. It's fine. Chelsea Birch, PRMC, Salisbury Practice Manager. Chelsea. Welcome, Chelsea. Shalala Brooks, Food and Nutrition Supervisor. Somebody's got to make sure we're probably doing food at the hospital. Okay, that's good. Thank you, Shalala. We have a promotion, Megan Caton, Foundation Assistant Director. Awesome. Catherine Fowler, Physical Therapy Supervisor. Is Catherine here? There she is. Welcome. Sherry Johnson, Social Work Supervisor. Awesome. Very nice. I'm feeling really good about communication. All these new people are here. That's good. We got things on their calendar. Lisa Kermish, Child Care Assistant Supervisor. All right, making food and watching the kids. That's a good one. Clap. I like that. Thank you. Okay, Ray Ross, Radiation Oncology Chief Physicist. Is that a promotion, Ray, or is Ray here? All right, well, we'll clap for Ray. Good. Angela Sonier, Occupational Therapy Supervisor. Excellent. Oh, we'll skip that one and more embarrassment in a few minutes. All right, Dornice Whittington, PRMG Salisbury Office Supervisor. Awesome. Okay, I have a list, but did I miss anyone? Anyone new to the group that we want to make sure is, if their supervisor could stand up and call them out? Anyone new that we missed? No, we're going to talk about you bigger. Oh, you want to intro? Oh, okay. Awesome, Bridget, congratulations. You have big shoes to fill. Not really big shoes, but you know what I mean, big shoes. So, all right, anyone else new to the group that we may have inadvertently missed? Michelle. Awesome, Sean, congratulations. I saw a hand go up in the back. Shout it out. Excellent, welcome. Anyone else? Going once. Cool. All right. Well, excellent. So we'll kind of dive right into it. As we've done in the past couple of sessions, I with Gwen's help. Where's Gwen? Is Gwen here? Gwen's not here, but Gwen was great in helping us get the presentation together for just to highlight some recognition that was going on in the organization that unless you were watching every posting on LifeWorks, you may have missed. But I also want to take a minute after we go through the recognition for any other announcements or recognition or thanks that you may have for other folks in the room or other departments. So think about that for the next maybe 10, 15 minutes while we go through this. And then at that point in the process, we'll have a couple mics to kind of go around so that obviously we don't have everything here going on, but we do want to get that information out there. Couple of introductions. I'd like to virtually introduce Andrea Williams. Just for your information, she is our newest member of the Hospital Board of Trustees. Andrea is the Senior Vice President and Controller for Purdue Foods. So she was a great addition to our Board of Directors and Board of Trustees. She replaced, how many people know Bill McCain? You guys know Bill McCain? Great individual. Bill served on our board for 13 years, and if you have a chance, if you see him out in the community, thank him for that service. He came off in October, and Andrea joined our board at that same time. So that was really great to see. Larger than life in some ways, at least on the picture. I want to say hello and welcome Dr. James Trumbull to the organization. So welcome, Dr. Trumbull. Awesome. part of what I talked about probably a couple sessions ago is a little bit of reorganization around the health system, really looking at the highest levels, the senior executive team and how we're spending our time, and really focusing not only on the big house, but what's also happening out in the ambulatory world. So we had 2 national searches going on. One was for the Vice President for Clinical Integration, and I'm proud to have Dr. Trumbull on the team as the Vice President for Clinical Integration. So Dr. Trumbull, we borrowed from a friend, as they say. I'll probably pay for this at some point in the future. But Dr. Trumbull came from Frederick Hospital, where he wore a couple different hats, and I know Dr. Snyder loves having him here because part of it was physician utilization. His background is that he is an ER physician by training. He was in the military. He served in the Air Force for 13 years. And ironically, Kathy Fidler and Jim Trumbull have the same rank. So I'm not sure. They're both majors in the military. So it's great to have him on the team. He's going to be working very closely with Catherine Fidler on the whole clinical integration population health out in the community. So he'll be working with doctors, working with people like Nancy Crichton as well, in our clinically integrated network to try to foster that sense of what is good evidence-based medicine and how are we taking care of folks in the community. So we're extremely excited to have Dr. Trumbull on our team. So awesome stuff there. You want to do another round of applause for Dr. Trumbull? I like that. Okay. Where's our PRMG folks? Did you guys save a seat for him? It feels like we have a void, quite honestly, because Dr. Tom DeMarco did retire just a couple weeks ago. We had a great little celebration for him, and luckily we get kind of small doses of him at the Cancer Center, which is good, small doses of Dr. D. No, I didn't mean it that way. You're going to get me in trouble. I'm trying to keep him around. Stop. So another person I'm looking forward to joining the team, and knock on wood, I never rest until they've actually, they're here and they've clocked in, is we do have Dr. DeMarco's replacement. Her name is Dr. Karen DeBari, and she's coming from the Guthrie Clinic up in Western New York, and really great addition. She works in what I would call a contemporary physician enterprise. The Guthrie Clinic is an enormous system up in Western New York. And she's the chief medical officer for one of the hospitals half-time. The other half of the time is she runs the primary care division for the western region of the Guthrie Clinic. So she starts January 7th. So knock on wood, we'll see her at the next meeting. I am happy to report she bought a house, so that's usually a really good sign. Yeah, exactly. And at that point, the executive team will kind of be rounded out and ready to move forward, which is great. A couple other people will embarrass. I kind of gave it away when Kelly stood up. But I want to say congratulations to Sarah Arnett and Kelly Wilson. Thank you. Stand up and be recognized. So as folks know, Cindy does a great job as the, she always had done a great job as the interim chief nursing officer. So we just decided to keep it there. So she is our chief operating officer and chief nursing officer. But with that, we wanted to, I know Cindy wanted to look at it, and we wanted to make sure she was supported. So we did create a new position, and it's the executive director of acute care services, and Sarah Arnett applied, interviewed, and was ultimately offered and accepted the position. So I think everyone knows Sarah's been doing a great job supporting the ER team. And equally impressive is Kelly, who came from a clinical manager role, who will be the director of Med-Surg services. So again, congratulations to both of you. I know, all right, more round of applause. Awesome. Wonderful. And at this point in time, I'd like to, we always take a couple minutes to talk about some of our Daisy Award winners, because these are great stories. These are the things that I think people love hearing about, some of the things that really folks are, proud father. Yes, proud father. True. Sylvia, I see the name. Okay, so we'll let Cindy talk about our Daisy Award winners.
Yeah, thank you, Steve. So we have had several Daisy and Sunshine Awards since our last day away. So we'll start with Steve Mears. Steve is a nurse practitioner in our Salisbury Family Medicine office, and he received recognition from one of his patients who was a veteran. And we just celebrated Veterans Day this week, right? So before we talk about Steve, how many veterans in the room? Stand up. Any veterans in the room? All right. Thank you for your service. So Steve Mears is in the October section here. He's tremendous, said this veteran. Because of Steve, I was able to see the specialists that were needed to find my proper diagnosis. And he has hypothyroidism and Hashimoto's thyroiditis. And Steve wouldn't give up until he found what was actually going on. And so because of Steve, I have quality of life and a care provider that I can count on to truly provide me with top-notch care. So thanks to Steve for providing exceptional care for one of our veterans and the other patients that he provides care for. The second one is Kirsty Sylvia. Yes, you recognize that name. Sylvia was recognized by a patient or a patient's daughter. My mother-in-law owes her life to Kirsty Sylvia. After a horrific accident, Kirsty stayed glued to her bedside, fighting to keep her blood pressure stable throughout the night. She provided thorough updates to us on her critical care state and assured me that they were doing everything they could to keep her alive. And she closes with the ICU cared for her mother-in-law as if they were her own family. So thanks to Dr. Sylvia's daughter. So a round of applause for Sylvia and Steve. And then in the middle, in the pink area, is Kathy Foxwell. And Kathy Foxwell is in our Peninsula Breast Center. She helps guide patients who have been diagnosed with cancer. And she provides outstanding care to make sure that the patients have everything they need, their questions answered. And the patients that are seen in the breast center are very anxious and at a high stress level. And her smile, and you can see that smile and embracing personality, gets patients through this very anxious time. So thanks to Kathy, and congratulations on Kathy's being recognized as a Daisy Award winner. And then next is the Sunshine Award. We had 3 of those as well. Selene DeMaeus is in the top left corner, and she's one of our nursing assistants, and she speaks Creole. So those of you who are in patient care, you know that's sometimes very hard to get a person that can actually speak the right dialect. And so this patient was in critical condition, and so they called for Selene to come from one unit to another unit to help them take care of this patient. When, you know, we have the language line, but sometimes that's not just as effective as having somebody who can really communicate. So Selene very willingly went over to the other unit to help take care of this patient, and it made all the difference. Things went very smoothly, they said. So congratulations to Selene. And then, yes, okay, that's fine. Then we have Vasa V. I'll just say Vasa V from 5 South. This young lady was this patient's CNA many times, and this patient was in a lot of pain. She was grumpy and was taking a lot of V's time, she said. But V was cheerful, polite, and compassionate through all 3 shifts. She was always as upbeat at 5 a.m. as she was at 7 p.m. when she came on. So all the nurses, CNAs, and techs treated her very nicely. But V, she said, was a bright, buoyant angel. So thanks to Vasa for being a bright, buoyant angel. And then last but not least, Mary Adams from 3 Layfield. A patient said she would visit me every morning when she arrived at work. Now, you know, we're supposed to do rounds, right? Every hour we round, every couple hours we round on patients. But this lady does it in a way that it's not something that she's checking off the list, because this patient said in addition to her direct patient activities, she would just put her head in the door throughout her shift just to make sure that I had everything that I needed, that I was okay. There was never a need to ask for anything because she can anticipate it before I even mentioned it. It made me feel less cut off from the world when she was there. She has a natural ability to make you calm and less fearful. She's an asset to PRMC and is surely deserving of the Sunshine Award. So congratulations to Mary Adams as a Sunshine Award winner. Okay, I'll turn it back to you, Steve.
Awesome. Thank you, Cindy. Back up. Okay. All right, a couple things on the Employee of the Quarter. Just take a minute to recognize folks. Nursing Division, we have Melissa Twilley, who is an LPN and anesthesia tech for surgical services. Where's our surgical services, folks? All right, excellent. Melissa, awesome job. She's reliable, flexible. She goes above and beyond. She's asked to train not only her peers but staff outside the OR on TEE probe cleaning. She's more than willing to take on any task that's asked for her. She's participated in several process improvements, and she's a great person to have on the team. So if you see Melissa around, definitely congratulate her. Also in the nursing division, we had Taylor Williams this past quarter. And where's our PCU folks? There they are. OLHA, excellent. So Taylor was awarded Employee of the Quarter. She started in the PCU as a new graduate nurse. Within a year, she's grown above and beyond. She's even chairing a shared leadership committee at this point in time, and she's just a fabulous person to have on the PCU team. Where's our supply chain folks? Yes, nice job. We know Keita Mitchell down in purchasing. She's being honored for her diligent hard work and kindness. There's been personal challenges in the department, and she stepped up and played an important role while not only covering her role, but other team members when being short-staffed. So Keita's a great person, and congratulations to Keita. And then where's our heart center folks? Awesome job. We got Michael Forbush, who is in the cardiac cath lab and EP. He's known to keep the cath lab running smoothly. He's got many responsibilities as a hub person, and he was honored recently as Employee of the Quarter. So congratulations to all those folks as employees of the quarter. On the physician side, how many people know this guy? He takes no need for introductions. Dr. Steve Hearn. Awesome individual. The last person who ever wants to think about these things, quite frankly, but sometimes it's not about him. And so he's the co-medical director of the cardiovascular service line. And I know, where's Jeannie? I just saw Jeannie. I know Jeannie looks to him as a crucial link, facilitator, somebody who corrals doctors, whatever you might call it. But Dr. Hearn does an awesome job as our co-medical director, and he was honored as a Physician of the Quarter. APP of the quarter recently was Leanne Mentzer. I haven't met Leanne, probably because they're always in the scrub. But anyway, she's a CRNA on the anesthesia team, and she was named Advanced Practice Professional of the Quarter. She has excellent values in her patient interactions and working with her colleagues. So she was a great recipient of the Physician of the Quarter. Awesome job there. A couple of other providers to be familiar with. I know Simona must be happy, right? You got a couple new hospitalists. Dr. Shahab. So he's a part of the hospitalist team. He went to Kasturba Medical College, where he also had his internship, and he did his residency at Howard University in Washington, D.C., and he's board certified in internal medicine, so great additional there. Haley Weingard, she's a new PA, and she earned her PA degree from Eastern Virginia Medical School in Norfolk, and is board certified in internal medicine. Where's anybody from CV surgery here today? Okay, the heart things must be going on. So good thing is we got Dr. Fawad Khan, who joined CV surgery. So I think everyone knows Dr. Kurt Wayberg left, but Dr. Fawad Khan joined. He came from, he did his residency and fellowship training. Actually, he was a general surgeon and trauma surgeon. So prior to becoming a cardiothoracic surgeon. So he was trained up at Montefiore Medical Center in the Bronx and Westchester Medical Center in Valhalla, New York, where he worked as a trauma and general surgeon. And then he went and did a fellowship in cardiothoracic surgery at Allegheny General Hospital in Pittsburgh. So what's fascinating is, you guys know Dr. Zach Baker? When Dr. Baker was doing his residency in surgery, that's what you do before cardiothoracic surgeon, Dr. Fawad Khan was his attending at that same place. And that's how we actually recruited him. Dr. Baker knew Dr. Khan. We had a need. And he said, I want to be, he came here, looked at our organization, especially the Heart Center, and we didn't skip a beat. And Dr. Khan's getting settled in here and doing great. So that was nice to see. And then we have Sam Brittingham, who's a physician assistant in the CV surgery. He went to Salisbury University, which was also great, before going to Marywood University for his PA degree. So awesome stuff there. A couple other providers who joined us in September. We had Dr. Lee, another hospitalist. So he went to medical degree from Second Military Medical University in Shanghai, and then did his residency at Wright Center for Graduate Medical Education in Scranton, Pennsylvania. So Dr. Lee joined us. And then we had Dr. Tiwari join us from a neurology perspective, which is wonderful. Yes, we've been without neurology services. I should say, we've been without ambulatory neurology services in Salisbury for some time now. So when patients had like emergent neurological needs, we would take care of them, but then they would have to get referred for follow-up either over in Berlin or up in Easton. So Dr. Tawari came to us from Washington, D.C. He had completed his residency at Howard University. He was chief resident, and he had a private practice in Washington, D.C., but heard about our opportunity here and decided to close his practice and join our physician enterprise as a neurologist, and we were able to transition now to having that more traditional ambulatory approach that also covers the hospital. So that was a great addition to the team and allowed us to get back into the neurology business. So good stuff there. All right, so some recognition. Chairman's Award for Performance Improvement and Quality, and I bet you we have some of the folks here in this room who are recipients of this award. So for third place we had recognized the Progressive Mobility Team. Do we have any members of that team here? Jill, yes, Jill Stone. You can stand up. Yes, Jill, nice job. So Jill worked with a team of physical therapy and nursing, really focused on getting patients up and out of bed. And it's great these days. You can walk around units and stuff, and the staff are getting folks up and out of bed. And is that important, getting them up and out? Yeah, absolutely. What is that evidence, Jill? Every day they spend in a hospital bed, how many days do they need to recondition? A lot. Yes, it's a lot. I think it's 7. But anyway, so if you're here for 3 days, you have 3 weeks. So the sooner you can get them up and out of bed, that's good. It's a good thing. So nice job there, and we're doing much better in that area. We had a tie for third place. We had the colorectal surgery improvement team, which anybody here from the colorectal? I see somebody, and she's the last person who wants to stand up. I see you covering your mouth there. Karen, stand up. Be recognized. Yeah, all the way. Awesome. All right, so we had nursing and physical medicine, sorry, that's a different team, surgical services and clinical staff, and they worked on processes for patient education, dietary practices, and the dramatic improvement on this one was reduced length of stay as well as reducing readmissions for folks on having colorectal surgery. So that was really, really cool. For second place, we had the Central Line Associated Bloodstream Infection Reduction Team. Anybody on that team here? Okay, they must be working on reducing bloodstream infections. Okay, so really, again, the goal, use the bundles to reduce infections. When you have a CLABSI, central line associated bloodstream infection, it's bad for the patient, it's bad for length of stay, you name it, and they did a great job on that team. And then finally, our first place team went to the Radiology Registration Improvement Team. Anyone from that team here? There you go, stand up, I see you here. Awesome. The registration and centralized scheduling staff assessed the causes of longer wait times for medical imaging patients. They identified opportunities, and they had a dramatic improvement in reducing the length of stay for people to actually go through that process. So that was great. And if you see back there, you see Wen Chow from Performance Improvement. He was on this team, which means I can guarantee it'll be in a Tier 1 journal by next summer as published research. So that's pretty good. Finally, we also had a recipient of the Ed Urban Quality Award, so which was great. It was the Sepsis Bundle Compliant Improvement Team. It was physicians and nurses. They put processes in place to improve our uses of the evidence-based bundle for sepsis. Do we have members of that team here? I saw Dr. Snyder. Who else was on that team? All right. Thank you. Great job. When we started the process, Chris, we were 20% compliant, and then it went up to 50, 60%. And the amazing thing is what improved? Mortality. People survived, and the data is it's fabulous to see it. So we were pretty low compared to the state and the rest of the country. Now we're doing a little bit better as compared to the state and the rest of the country. And more importantly, lives were saved by using this bundle to take care of patients. So that was really, really great to see. Awesome. Thank you, Chris, for leading that effort. Another recipient that we recognized at the November board meeting, and this is the danger of recognizing people, is Mickey Griffin here? No, she's not. Where is she, Keith? Did she know she was going to be up like this big? Is Mickey's team here, Keith? All right, well, good. All right, awesome. Congratulations to Mickey Griffin. She received the President's Leadership Award. This is something I continued that started with Peg, and really looked across the organization with the help of the exec team to say who is doing an exemplary job from a leadership perspective. And when you look at what the revenue cycle's done, 2 years on Epic, the amazing performance they had. In April, if you remember, we talked about them being recognized within the top 10 of the Epic community. As far as our use of the system to facilitate the work that they do, top 10. We were pretty happy. And then they got top 5 at the September meeting. So just great work to the entire team. And that's not just the revenue cycle, don't get me wrong. It's the operations people, it's the coding people, you name it. But Mickey was obviously instrumental, and the support that she provides each and every day to the revenue cycle. She was recognized this year for the President's Leadership Award. So do me a favor, when you see Mickey, first, give her a hard time for not being here. No, I'm just kidding. She probably has a good reason. But please say congratulations for her receiving this. It's pretty impressive. So, all right, there you go. More applause. All right, now we'll get into some of the fun stuff as well. Congratulations to everyone in the room. You may have seen that we were recently recognized by Leapfrog as a A-rated organization. So, we've got health grades out there. We've got CMS, and sure enough, Leapfrog's data it reflects great performance. So Leapfrog, you might not be familiar with them, but they were started a number of years ago by employers. Okay, because employers pay for health insurance for employees, like we do, and the employer community wanted to identify high-performing hospitals from a safety perspective. So for a number of years, Maryland did not submit the data because, well, we're Maryland, and sometimes we do things like this. We didn't participate, but last spring, was it spring, Deb? Was that our first time? Last year, fall? When did we start? Okay, but the first set of data we had a C. Maryland submitted the data, and it was like incomplete, and we didn't really know what was going on, and we got a C, along with just about every other hospital in the state of Maryland, C's, D's, whatever it might be. So Deb Sheets, and who else, Deb, helped you on this? Big effort. Okay, if you were involved in that, raise your hand. Yeah, there's a lot of people around the room who we took the time to say, all right, well, let's understand what we're being ranked on, okay? Let's understand the test that we're being given, and this team took us from a C to an A, which was pretty phenomenal. Now, we just made it. We got to keep working hard. Quite honestly, it was like an A-, but hey, it's an A on the board. We'll be okay with it. But a lot of hospitals, yeah, some Maryland hospitals improved, but we were one of 7 or 8 in the state of Maryland that got A ratings. We're the only one on the Delmarva Peninsula that has an A. I think our closest one is Nanticoke got a B, our friends up at Nanticoke. That was the closest one we had. But again, talk about a process to look at something, look at our process, submit the right data, study for the test, and our performance was reflected accordingly, which was awesome. So thank you to that team, but just as importantly, more importantly, thank you to everyone in the room, because it really is just one more attestation to the safety and quality performance that we're able to provide here at Peninsula Regional. So good work there. All right. Okay, what a break. Thank you. All right, we had a flu drive. Who was involved in the flu drive here? Raise your hand. Lots of folks involved in the flu drive. 2,446 flu shots given, which was a pretty big increase from last year, right? 700 more. It's like supply and demand. When you give it away for free, more people do show up, and that's what we did. So you know what? It's an investment. If we can reduce admissions, if we can have people not get the flu, it's a great investment. And our team was awesome out there. I went out there, and somebody asked me, did you get your flu shot? I told the truth, and I said, no, not yet. And they said, let's take your shirt off right now and do it. And they stood in line to inject me. So I forget who the lucky person was, but she was pleased, piercing. Anyway. But a great job, and that was more demand than we even thought that we would have. And I know that the pharmacy team was kind of working hard getting vaccines there and so forth, and it was just great to have things there. All right, next cool thing that's going on out there, it's in the physician enterprise. We have this thing going on called Team Care Medicine. So I want to thank and recognize the physician enterprise team. Raise your hands, table. Awesome. The whole, yeah, Come on, people. Raise your hand. Thank you. Good. I know Gina Greer was instrumental in this. We engaged a company, and she worked through and helped manage a project where we're actually changing the lives of primary care doctors, okay? Which right now, if you're a primary care doctor out there in the community, and even we still have a lot that this is their life, they're working hard doing patients all day. They don't finish their notes, and they take work home, and they're working into the wee hours of the morning doing electronic healthcare record documentation, because the EMR is kind of a rate-limiting thing. We're doing a lot of work in that area, and people like Dr. Mark Wiseman and IT and the ambulatory group are helping, but it's just inherent that there's stuff the doctors are doing that perhaps we can have other folks do. So this team care model takes the medical assistants and it really trains them up to a whole new level to where the MAs are really working side by side with the doctors and helping them do stuff. Like they'll do an intake. They'll set things up in the system for the doctor. So the doctor will ask questions. So the doctor can really focus on what does the doctoring need to be in the room. And the MAs are pretty much doing everything else. They're scribing. It really is, number one, improving the lives of the doctors. It's also skilling up our MAs. And they're getting recognized, I think, from a growth perspective as well. So it's really, we've had some providers who literally, folks, if I tell you they were crisp, do you know what I mean by they're crisp? They're just like not happy campers, they've said this has changed their lives for the better, which is an awesome thing. There's 5 providers who were trained in the first round. We're setting up the second round. This is a differentiator for us in our physician enterprise, so much to the point where we've had other physicians now come and observe this who don't work for us, right? And they see this, and now they want to work for us. I'm happy to report Dr. Ron Travitz. You guys know Ron Travitz? I can happily report that he is coming on board in February as a physician, as part of our practice group. And what brought him here was this investment, and really he was in that other world, and we're able to help him have a better life as a result. There are other physicians in our community that want to come on board, and this will help with recruitment and retention, and it's just a great way to run a practice. So that's really cool. All right, so that was fun. How about this for being fun? Who was a part of this Real Chaos team? Who else? Anyone else here? Come on, Brandy. Where's Brandy? Staff meeting. Okay. All right, so thank you, Dr. Inc., for facilitating this. But our Real Chaos team, and I don't know if you could see it. Michelle, you're here. I see it. You're hiding back there, yes. They raised $29,000 to the American Cancer Society breast cancer research and services through getting a team together with donations. So I had pictures of fish. Sorry. Darn it. I'm sorry. Maybe next time. I had pictures of them actually with fish. So that's really cool. Where are Sarah and Teresa? Sarah and Teresa Niblett. Yes, awesome. Please stand up, be recognized. We did make our United Way goal. Awesome. I also want the folks, if you were part of the United Way steering committee, raise your hands. Awesome job. Round of applause for them as well. So this was great. We $160,000 was raised by our employees through the annual donation process. So thank you to that steering group. Thank you to Teresa and Sarah. Thank you to each of you who was either a team captain or supported your team captains within your department, because those are the folks who often have to carry the message and answer the questions. And quite honestly, they're the most important are those team captains. This is one of those messages that if you hear about it, it usually sells itself. Again, we make a point not to tell nobody has to donate. We just want to get the message out there about the opportunity, and like I said, it usually sells itself. So great job on the United Way campaign. All right, where's our Richard A. Henson Cancer Research Institute folks? I thought I saw them here. Okay, so we had the Hopkins folks here in Coastal Hospice recently at our Research Institute. So I bring this up because how many people know we have a Research Institute? Okay, everybody in this room, that's good, all right. But it's one of those things that's kind of been out there from a time and energy. Joan, how many people do we have working in the Institute now? 6 people. So 6 people full-time work in this research institute. It's part of the Johns Hopkins Research Network, and it's a great thing. We actually spent time at an executive team day away. We don't really go away, by the way, at the day away. We just go to Bruce's conference room. And we talked about our investment in research and the importance of that. And this is kind of like that team care medicine thing. It's got a couple benefits. One is that, some doctors really want to participate. So for recruitment, it's a great thing. But more importantly, it also allows patients on the Eastern Shore to have access to research trials through Hopkins or other organizations. It helps our cancer center, that's the primary beneficiary, accrue patients for perhaps better care, being exposed to an opportunity that may change a life. So not only does it have the cancer center implications, I can see us going forward doing a lot more research around population health through our research institute. We are a great little learning lab here on the Eastern Shore. We're somewhat isolated, and Hopkins really wants to help us do research on population health related activities in the future. So a little plug in there for the Research Institute. All right, more fun. How many people took the opportunity to dunk Bruce Ritchie? Raise your hand. I did. All right, so I forget, actually, I probably have it here, the number. Let me see. We don't have the number, but I can tell you, Bruce was a little concerned that he might not have people willing to spend money to donate him. Bruce made more money in that hour, that half an hour, or whatever he was up, that 15 minutes, whatever it was, he made more money than all of us combined. I told him that would be the case, but hats off to Bruce. Give Bruce a round of applause. Bruce could not be here with us, so he has to watch this on video, so that's even worse. But so again, we had our barbecue, and we did raise quite a bit of money for the Employee Hardship Fund, and this was in Bruce's goals, and this is a good example of how you can use goals to motivate behavior. Okay, it was a small variable thing, but it is a good example there. All right, so what about Halloween? Did we have some fun on Halloween? Yeah, tell me about it. This was a little bit different for us. We had people get dressed up all over the place. Are these the Spice people? Yes, these are the Spice Girls, apparently. We had the purchasing team with the Cat in the Hat. They won first place. The Spice people were second place. And Tanisha Shepard, the nun, that is a scary nun, was first place. We had a lot of other folks. We had the cash people in the revenue cycle. We had all kinds of people around the organization dressed up, which was quite nice. This is one of my favorites, actually. Do you see the people in the upper right-hand corner? These are the doctors, in the cancer center, so how cute are they? But I do want to thank, actually, these folks here. It was their idea. This was something that the cancer center came from a we want to do this perspective. And hey, we're all about change, right? It might not have been something we did in the past, but we said, you know what the heck, let's give it a shot, and as long as nobody scares anybody really bad, we should be okay. And sure enough, Mitzi, we had to have one conversation with somebody that might be too scary, is that right? Yeah, only one. So if you think about it, only one person we had to have a conversation with, that's probably too much. But again, from an employee engagement perspective, a lot of people, we tried to round a little bit more that day. A lot of people were like, man, I wish I knew about it. So we did it a little bit subtly this year. We didn't really advertise it heavy and stuff like that. But I think we feel good about it next year, and God help us what we'll see next year, for Halloween. We have had requests now to dress up for other occasions, as you might imagine. So we said we were going to allow Christmas, right? Yeah, we'll do Christmas. So again, if you want to dress up around the holidays, I think we said Christmas Eve, Christmas Day, 48 hours. Yeah, that's what we're doing. Those 2 days. And I'm not biased to Christmas. It just happens to be we picked 2 days. So whatever holiday you want to dress up for, that's fine. But again, we just have to keep it appropriate, and we'll go from there. So good stuff. All right, I'm almost done, folks. Just a little bit more recognition. PRMC Trauma Team earns the American Trauma Society Maryland Chapter Distinguished Service Award. So hats off to our trauma center. Awesome. Okay, and our ER team is as always, I see you in the back. Women's and Children was honored by the Maryland Patient Safety Center recently for a lot of the collaborative work that they, where's our Women's and Children's folks? Awesome job. These guys just keep racking it up, let me tell you. Awesome. Last quarter, it was top 10%, right, for health grades, 5-star. This time, it's the Maryland Patient Safety Center, so just great work that that you guys are doing up there. We're so glad to see it. We also had a little bit of another milestone, right? Date of birth, 11/1/16, epic. That would place it at the terrible 2 age. Thankfully, Dr. Mark Wiseman is here to help with that, so it's getting better all in all. And I want to put a little bit of a plug in for MyChart. Epic really is good. It's not a bad 4-letter word, because quite honestly, I do believe this, and I always repeat it. Epic does not make us do anything. Epic is a vehicle that allows us to make choices. Sometimes we don't make good choices, and we blame it on Epic. That's really the root issue here. We need to make better choices sometimes. MyChart is a great tool within Epic. It allows us, right, the members of the community, to engage our record and engage our providers in a more efficient and effective way. Okay, so I can use MyChart for results. I'm really happy. Are we pulling the result time down? Are we going to auto-release results? Thank God. All right. I appreciate Dr. Wiseman plugging that along with. I know Rob and I have always been on the same page. These are my results. Sorry, doctors. So auto-release of results, and I think PRMG. Are you guys going to do some self-scheduling? Awesome. So these are reasons that will allow people to want to use MyChart. So I can self-schedule, I can see results. Let's face it, if I have an app, I have to have a reason to use it. Those reasons are coming, which is great. So please sign up for MyChart. How many people have a MyChart account? I'll close my eyes. Okay. So please sign up for that. And again, our goal is to have more uses for it, so it just becomes a perpetual thing that people want to use it. So some good stuff going on with MyChart. Yes. Yeah, I'm sorry, My Pen Care. Oh, I should use our branding on that. MyChart is the application within the Epic portfolio. It's called My Pen Care in Peninsula Land. So thank you. Good clarification, because if you went, you probably signed up for some other hospital's MyChart and then wonder why you didn't get anything. All right, and last but not least, Cindy mentioned this. I just want to reemphasize it. I won't have you stand because I know veterans don't like to be recognized, but you do have our thanks. We had some flags placed up in the Hannah outpatient lobby, so if you haven't noticed those are beautiful. They kind of add on to our addition last year of the veterans flagpole. So we have each of the branches of service hanging proudly, as well as some of the local flags as well. So again, thank you to our veterans. So with that, yes, another round of applause, Keith. I like that. So with that, I do want to take a second and see if there's any other announcements or recognition from the group. And Dan and I will help with the microphones just for stuff that you may have. Remember the homework 25 minutes ago? Think if you have anything that we didn't cover. Anything else out there that you want to take a minute to recognize someone, share something? God, do I have to do everything, folks? All right, so how about the Salvation Army bell ring? Oh, thank you. You got her? Okay.
I'd like to recognize I think they're back over there, the psych team, for all of their effort for our pilot for telepsych, making that available to Dr. Serrato and our youth of the community so that they didn't lose that service. And Maria and all of the endo team for their work to start teleendocrinology in the Berlin office. So thank you for that.
Awesome. Jeannie Ruff.
Certainly would like to recognize the foundation in our successful Love Your Heart luncheon that we had on November 7th, a wonderful experience trying to use now your right brain instead of the left brain from an artistic perspective, which was really a challenge for me and others, but it was great. Also, for all of you that helped us execute our successful left atrial appendage closure device, which we did last Friday, November the 9th, and the patients are so grateful, and I'm so grateful for all the support that all of you gave me. And I know, Keith, it was a little shaky yesterday in terms of the financial piece, but we got it covered, right? All right, thank you.
Good one. Weaving our way through. Sorry.
I just want to recognize Patient Care Services. On Monday, we're going to be delivering 20 to 25 Thanksgiving dinners to the United Way. So all of the nursing units, respiratory, physical medicine, all brought in items. So we're going to complete those baskets, and the board of directors are going to provide the turkeys.
Awesome. I didn't realize that. Nice job. Other announcements? You got her? Okay, cool. Thank you. I'll hang back here.
Hey, Dan. I just want to take a moment to recognize John Jordan. I think most of you know him. He's been here since 2001. He actually got a very prestigious award from, and I'll read it because it's so long, from the 2018 Maryland Society of Health System Pharmacies Pharmacist of the Year Award. And he knew about this award probably a couple of months ago, but never mentioned it. So one day I asked him, I said, "Where are you going?" He goes, "Well, I'm going to an awards dinner." So this is how humble he is. But he actually started our ICU multidisciplinary rounds with the PharmDs involved. He started with our hospitalist group rounds, the antimicrobial stewardship program, and the big thing, obviously, is the residency program for the pharmacists. So I think that's a big deal, and I want everybody to really recognize John, because I think he's contributed a lot to this organization. So.
Awesome. That is impressive.
Many of us serve on different boards or different associations throughout the community, but I do want to recognize Bev Stokely. She serves as the chairperson of the Lower Shore Enterprise Board, and I just got to give her some kudos. She's been going through a lot. They're going through a CEO change, so those residents or those individuals that are in that organization, it's a phenomenal organization, but I just want to recognize Bev for representing PRMC on that board of directors and leading them through some challenging times.
Nice job. Anyone else? All right, while I'm walking, I'm going to put a little bit of a plug in for an upcoming event, Salvation Army bell ringing. So I know a lot of people have signed up for that. We appreciate the commitment to kind of get out in the community and support that cause. Karen Blades has the sheets with the few remaining slots left, so we would love to walk out of here with those things filled today. So, yep, there she is with the hands going up. So, awesome. So, thank you if you've signed up, and thank you if you plan to sign up by the end of today. All right, so we're going to continue on. I got a couple more slides, and then we'll take a break before we talk about some what's ahead stuff. So, what's happening in the region? Lots going on in the region right now. First thing I'd probably talk about is McCready. This process continues, as it's publicly acknowledged that we are in discussions about a future state for Somerset County. And I'll tell you, we're getting really close to kind of codifying that from an agreement perspective. So I'd like to think by our next meeting, but I think I might have said that this meeting, that I can probably talk more about that. But we've a lot of folks in this room have been working on that effort. So I want to thank everyone who's been working on that effort, and I'm pretty confident that you'll probably see some stuff released later in December, early January, about our plans for Somerset County in supporting sustainable healthcare services for that community. This is an interesting map that we used for another discussion we've been having with, I'll just leave it at another hospital. And it really talks about our service area. And when you really start putting all the dots out there as to where PRHS stuff is sitting, can you guys see that okay? It's a lot of dots, if you think about it. There's quite a bit happening out there throughout our region. So whether it be our family medicine practice locations, which are likely going to grow, or our specialty practices, which I will tell you are likely going to grow with more new practices coming on board soon. We're kind of all over the place, which is a great place to be. So on this map, and we'll probably put this out online somewhere, Chris, because I just think you guys did a great job kind of taking the time to put everything in one place. But if you look at it, it's almost 500,000 people we're servicing, okay? Between the red area and the yellow area, there's 484,000 people. That's pretty impressive. And I think you've heard me say it doesn't include the 300,000 friends that we have visiting from the Western Shore every day of the summer. So we're servicing about 780,000 people. And we're it, quite honestly. So if you're here visiting, and you know what, people come on vacation, and sometimes they have their babies early, right, Diane? Sometimes they decide to have heart attacks. Sometimes they decide, and they don't decide those things. But if you think about it, something I've been talking more and more about, and just getting, quite frankly, more frank about it, especially with people throughout the state, is, quite honestly, we take care of the entire state of Maryland at one time or another, and that's something we should be pretty proud of, you know, from a service perspective. And it's, quite frankly, something the state needs to recognize. So a couple things that are happening specifically. I want to take a time to give a shout out to our lab folks. Where's our lab folks? Raise your hands. Awesome. 13 of those dots are lab draw sites. 13, what is it? Oh my God. See, I just told them, don't even tell me anymore, just keep growing. So I highlight the lab because one of my favorite barometers might be the fact that their volume continually goes up. These are 16 million something RVUs 2 years ago, and almost up to 18 million RVUs in this last year. So that's really quite phenomenal from a lab perspective. I know Matt Penrose, as our outreach manager, is out there constantly engaging with providers, and I make it no secret that one of my personal goals is to put LabCorp and Quest out of business. If you have family who work there, I'm sorry. But I want to see our lab doing every specimen on the shore. I know we're doing well because LabCorp came in again and offered to kind of buy us or partner with us, and Tim and I just kind of sat back and, you know, wanted to, you know, we listened. So that's always a very, it's a good acknowledgement when, like, the competition wants to come in and partner with you, and we just kind of say, yeah, thank you, and we'll just keep taking over your contracts. So, so that's great job to the lab team. Keep it up. A couple things that have happened. Yeah, round of applause for lab. Couple things. Core Life is now open in Salisbury, Easton. Kathy's not here today. Chester. Where else? Berlin's open. So we got four locations. Is Millsboro getting ready? And the second Salisbury location, I think we told them that they can. I think they may be looking close to the hospital actually. So we're going to be up to 6 locations before you know it on this idea called Core Life Delmarva. I expect us to probably have 10, 12 of these things. We are the exclusive owner of the Core Life Delmarva, so any site between the canal and the bridges in any direction is going to be ours. It's going to be a great vehicle to engage the community and folks specifically who struggle with obesity. And it's a chronic disease that's out there that leads to all kinds of other bad things. And we're going to be in a great position to really support the community differently by adding a service like this. So it's great to see Core Life expanding. And you hate to see a wait list for people to get in there, but it also tells you, yeah, we're doing the right thing. So that's we'll get through it, and we'll get them healthier and well. From a Woodbrook perspective, Woodbrook is rapidly shaping up to be our ambulatory, kind of like our Ocean Pines campus for Salisbury, just as a heads up. So we actually opened up the neurology and neurosurgery building in Woodbrook in the last couple of months. This was a great effort to bring neurosurgery and neurology together. Remember, Dr. Tawari's here, so we're able to put those together. Yeah, that's the longest cutting line I've ever seen. Anyway, we're looking at other practices there, quite honestly. We've been having conversations with the physician group. We've got a couple offices that probably need to be addressed, moved, adjustments. We're probably looking at a couple more family practice sites in Salisbury. You got people like Dr. Travitz coming, and Dr. Travitz, in my guess, is going to be the first of many coming. Then we're going to have to do some expansion in the Salisbury immediate area for primary care, which is kind of neat. We're still looking at another primary care office in Berlin. We have one in Ocean Pines. We're looking for one in Berlin. But again, primary care, with everything going on at the state level, trying to keep people healthy and well and out of the hospital, we view primary care as a bottleneck, essentially. There's just not enough of them out there. CB, they just did a physician needs, and we're about 15 primary care doctors short right now for our service area. And guess what? In another 5 years, 15 more retire. So CB and I have a lot of work to do with the physician enterprise and get more primary care. Ocean Pines continues to grow. We put the shovel in the ground for the GI Center for Dr. Kanakis and others over the summer, but I was happy to drive by the other day and the foundation's in, so now this thing's going to start to accelerate, which is great. Still on track to open up that next summer, so that's really exciting. The big building there, marked by number 3, I guess we're going out of order, but we are, is under development right now by the developer and the architect firm Becker Morgan, and folks are actively engaged with them designing spaces for specialty. I can't say like which specialties, but I can just tell you like the usual suspects or partners that we hang out with. They're looking to move their space from Franklin Street up to Ocean Pines. So I hope to kind of see us move forward with that in the next maybe in the spring have a groundbreaking once we have a critical mass to do that. And then I'd be happy because that campus is done and we can move on to other stuff. Endocrinology opened up in Berlin, so thank you for giving a shout out to endocrinology. But again, diabetes, it's a tough disease, and thankfully we had another endocrinologist come on board, so we were able to start spreading out, so not everyone had to come to Salisbury for endocrinology, so we have that practice there. And then finally, the Millsboro Health Pavilion. There's not much going on there, so I can't really say much about it other than that it's there. It's probably something we're going to go back and look at because it's not quite working in my mind as well as some of our other campuses are. It's never really had the destination feel like Ocean Pines or Woodbrook, and don't get me wrong, the building's full now, but it's not really the place that community says this is our healthcare center. So the city would like us to do something different. We're curious about doing something different long term there, but that's a couple years out. Behavioral health, I'm happy to report that our child and adolescent certificate of need, what do they call that? Clarifying questions? Completeness questions. So we heard from them. That's the first good sign. We submitted this thing back in March to get into the inpatient business, and we heard from them. They actually, 7 months. So I'm not sure about you guys, but 7 months it took them to respond. So we responded in, and how many days did we have to respond? 10 days. It's just, that's the deal you get with the state, right? You know, they take 7 months, you got 10 days. So we answered the questions, we gave it back to them, but hopefully we'll start greasing the wheels there. From a health system perspective, just 2 more slides left. A couple things just to point out. Who do I want to talk about? Your Doc's in. Happy to say that I think, what month did we just complete? October. Our volume broke even. So that moved from an entity not having enough volume, this is the one in South Salisbury, to the volume now breaking even. So that was good because in order to get that volume, you have to take it from other people. So the urgent care center probably on the S-turn is not doing as well. So that's heading in the right direction. Probably won't go into much there, we're a little behind. On the collaborative side, lots going on with our partners First Across the Bridge. How many people were aware that we own part of that thing called the Advantage MD, the Johns Hopkins Medicine Medicare plan, the Medicare Advantage plan? We own like 6% of that, and happy to say that it's moving towards not losing money. Okay, it's a good thing we only own 6% of that because we have to like fund it, and Hopkins has to fund a lot of it. But the good thing is enrollment's getting more and more, and they're getting better at managing patient care, which is really the important thing. So that's slowly heading in the right direction. On the Bay Health front, our partners up in Milford and Kent General, that's Bay Health. We have a great relationship with them. We're entering into some discussions now where we kind of go through every couple of years of strategic planning. So in the month of December, we're talking about what do we want to be doing the next couple of years in this relationship. My goal is to get to something programmatic. A lot of the work up till now has been like what I would call knowledge sharing and perhaps Scott's in the room contracting. I want to start seeing us do like real programs together, actually partnering from a clinical perspective. Admittingly, though, they got a lot going on. They're building a brand new hospital up in Milford. It's beautiful. They're competing heavily with our friends at Beebe. So on that map there, that whole northern half of Sussex County, Bay Health is quite busy right now kind of dealing with that. Beebe's expanding. They're coming further south. There's talks of freestanding ERs here and there. So it's nice that our heart center gets all the cardiac referrals, but they got a lot of dynamics going on in Sussex County that eventually we'll probably have to pay a little bit more attention to, quite honestly. You might not realize this, but about 20% of our patients come from Sussex County. About 24% of our revenue comes from Sussex County. So when you start talking about, like, why are we in Millsboro, or why are we in Laurel, or why are we concerned about Sussex County, it's actually a fairly significant size, a fairly significant portion of our book of business. So it's important that we continue. And again, we have specialists, we have open heart. We need to keep them busy, we need the referrals. If the case needs to be done, we want to be doing it. So is there a section on the agenda called like what's ahead? Yeah, so this is kind of the deep stuff, as I say. You know, it's great recognizing folks, but sometimes we got to sit back and have some conversations about where we're going, what's ahead, maybe some of the challenges that we might have in that process. And sometimes you have to do that, you know, maybe take a step back, really to take 2 steps forward, for lack of a better word. I'm going to put out there right now, we do great stuff each and every day. We really do. We do amazing things. In each and every department, whether it be touching the patient, supporting those folks who are touching the patient, behind the scenes, on stage, whatever it might be. But I think folks would agree, you know, we could do better, and we can be better. And that's what I want to talk a little bit about, what's ahead. Something I spend a lot of time in orientation, and I think it's always time well spent. If you want to talk about your future, recognize your past, right? And when you look at our organization, we do have an amazing tradition. That's what I call it, kind of in orientation, our tradition, you might say. 121 years old, started by some mission-driven individuals, Dr. George Todd. These folks did amazing things and have always been clinically exceptional. And people joined the team over the years, and you look back and you say, my God, I mean, they did open hearts on dogs. I mean, they brought the latest things to our little community here on the Eastern Shore that really, in many ways, set us up for where we are today. And we should be grateful. We should be thankful. We should be asking the question, what are we doing to set folks up for 20 years from now? How are we positioning this health system so that, you know, when we're all having people take care of us, they're saying, wow, look what they did to position us for the future. And you can look back on names like, you know, Nevins Todd, Michael Buchness, Don Woods, Virginia Layfield, and you can be thankful for what they did for us here today. Some folks behind the scenes, Don Durham, thankfully he was looking after the money, you know, and good for that. And you can start thinking about names, you know, that people are going to talk about 20 years from now. I think about people like Karen Poisker. I think about people like, she doesn't know it, but, you know, Sophia Shakur has changed neurosurgery on the peninsula forever. And so, you know, 20 years from now they're there, but we have to do more. We have to figure out, okay, how do we need to evolve so that this system is, you know, looking as good as it does today, 20 years from now, in a highly volatile environment. I don't want to take away at all from, like I said early on, the great things that we're doing every day. And thankfully, I think we should be proud of these things. And you know, you look at the quality and safety things that we do. I go back, that idea of being clinically exceptional, that goes back prior to any of us being here. It's just in our DNA, quite honestly. It's just kind of who we do. It's how we bring people on board. It's just the day-to-day interactions there. Thankfully, our mission, you know, really continues to serve and inspire us, you know, in terms of improving the health of the communities we serve. In many ways, I think it's more pertinent now than ever, you know, with the new Maryland model, the model I have a love-hate relationship with. The mission is great, though, and I think we should look at that as an awesome challenge. That's our challenge in the future. The challenge 20 years ago is how to be the best acute care hospital you can be on the Delmarva Peninsula. Our challenge in the future is how do you transform a system into something that can take care of a population throughout the region. That's our challenge, I think, from a leadership perspective, is how do we make that transformation, much like folks before us set us up to be one of the best acute care institutions out there. When you look at, again, this map, there's lots going on here, and will be going on here into the future. There are a number of sites out there. There's a number of people providing services out there. There's an amazingly fragmented delivery system out there here on the Eastern Shore. I mean, there's different hospitals doing different things, different sites doing different things, different community agencies kind of spinning here and there. And quite honestly, what everyone's looking for, and maybe not saying it, is who's going to be that one that's going to integrate, connect, and provide that service across the continuum, because it's not going to happen, quite honestly, unless someone steps forward and does it. It's not going to happen with all of these different kind of competing priorities and agencies and so forth. And when you look at the different hospitals out there, even the smaller facilities, I think in some ways are saying, McCready has verbalized it, and that's the one we can talk about, but the smaller facilities are saying, who's going to be the one to kind of take the reins of the region, from a population health and wellness perspective. And my challenge to us is I believe that's us. And luckily, if you think about it, we said in our vision that should be us, really achieving world-class health and wellness across the continuum of care. Why is that important? Well, I guess the first question you probably have is what is world-class? If you remember our house, we kind of defined it in our pillars. We said world-class. Well, number one, world-class is whatever you say it is, by the way. That's just the reality of it. But for us, world-class is being in the top 10% of everything. And that's not in the top 10% of hospitals. The top 10% of everything is you are in the top 1 or 2% of hospitals out there. So we have a good history of doing well in that clinical and that quality and safety column. But the reality is the other columns, we don't do as well at. That's the reality. That's kind of the hard message out there that we need to take a step back from. Why is it important? If you look at the community out there and you want to be the one to provide that value proposition to the region, you got to be the best. Okay, I'll tell you a story about a hospital called Pudro Healthcare. It's one of my favorite hospitals, and they don't even know I'm like a fond admirer of them from 2,000 miles away, but they're out in Colorado. They're over in Denver. They were the Baldrige recipient back in 2008. They became world class. They got everything humming on the right cylinder, as you might say. And what was interesting about that is people started to look at them and said, we want to be a part of you. We want to work with you. We want to connect with you. We want to establish relationships with you. They actually, as a small hospital, took over University of Colorado. Okay, so here you have this small hospital, not a big hospital, but about our size, quite honestly, maybe a little smaller than us. They got so good at everything they do, people wanted to be connected with them. And my challenge is, if we're going to be that organization that is going to integrate this region, we've got to be the Pudro Valley of the Delmarva Peninsula, to the point where you just don't want to not be a part of it, right? And actually, University of Colorado, huge institution, academic and everything, and they ended up merging with Pudro Valley, and guess what? Pudro took over University of Colorado because they were so good. That's my challenge. In order for us to achieve this in this region, we've essentially have to dial it up in terms of how good we are at what we do. We have a great foundation. Again, I'm not taking away from that, but we've got to do something different. Our house, essentially, it tells us we want to be in the top 10%, but the reality is this is our scorecard for the first 3 months of this fiscal year. And you guys probably can figure out it's not probably where we want to be, right? How do you know it's not where you want to be? We make things yellow and red. It's kind of simple. I'm a very simple person, and it's not where we want to be. If you look at our quality, clinical quality and safety, service, engagement, strength, and finance, ironically, Bruce is not here. Ironically, finance is the only thing that's green. It's not going to stay green, by the way. We have to give some money back to the state. But we need to get better, and I'm not taking away from the awards, but the reality is if you look at what we're doing, we need to get better in our domains of service. And again, we're 5-star. We want to be better, though. We need to be better. We want other people to say we want to be a part of you. From a patient experience perspective, this is an interesting one. How many people get this in their email and like run to open it up? I know I do. I know Cindy does. We go back and forth talking about it. Ironically, if you look at where we are from an overall rating of care perspective, our 0 to 10 score goes up. But then if you look at the domains, we're like this all the time. You know, we're up and down at different times. You know, communication with doctors was in the 7th percentile in this latest report. And they were in the 60th percentile previously. We're challenged that way as an organization. And what I'm saying is not anything different than any other organization, quite honestly. Every organization out there is challenged with ups and downs. And that's what we have to figure out is to how to get away from the ups and downs and have something more consistent. My concern, by the way, is those ups and downs are going to affect these things probably next year. These things roll on 3-year cycles. And our 5-star was on a 3-year cycle. We had more ups than downs. And what's going to likely happen is if we will probably go down a little bit, much like we did back in 2010, 11 when we were health grades 5 stars. We had an episode where we went down. But that's not what anyone in this room wants to be doing. I know that. We want to be the best. I tell people in orientation, we want to be the best because we're a hospital that takes care of people, and that's usually the mission of organizations, right? We're in healthcare because we like taking care of people, and we want to do a good job. My challenge is, guess what? We're taking care of family, friends, and neighbors. Our bar's even higher, and you gotta have to kind of wrestle with that and say, yeah, that's even better. It's more of a challenge. I do think we're an organization poised to reach greatness. I absolutely believe that. If it weren't for the variability that gets in the way. That's the challenge, is the variability. It's not being quite as consistent with the things that we need to do. And the good thing is, I think we can get there, quite honestly. This was something that I put out a year ago, I think, literally speaking, when we were in kind of the transition mode. These are things that we're constantly thinking about. How do we have excellence across every organization in the health system? And it has to start with us. Some of the things that we're doing, we're evolving the new system. We're evolving our system in this new world, which is good. And we're looking for partnerships and collaboratives. And quite honestly, the exec team probably hates me at times because for some reason, since the transition, everyone wants to partner with us, and I did not plan that, and it's just a lot of work. But so that one's kind of checked off, but we have to come back to the first one. If we're going to be that integrator across the region, if we're going to really look at the continuum of services, we got to come back to excellence at PRMC. So what's the title of today's sessions? Change. Yeah, exactly. Sometimes change is just doing what we should be doing, quite honestly, more than we have been perhaps in the past. When I look at the scorecard, I look at that and I say, well, what to focus in on first? Because quite honestly, if I were to say, well, focusing on it all, what happens? Nothing happens, quite honestly. We kind of spread our focus and things don't happen. What's the most important thing on there? Who said it? It's like you wrote the presentation. Exactly. Engagement. Right now, our employee engagement is in the 31st percentile of our last score. So we did a survey a year ago, I guess in the fall, and we're going to do another survey in May. And what I can tell you is that our team's just not quite the rabid participants that we want to have. They were the 31st percentile a year ago. Any idea what they were in the survey we just did a month ago? 31st percentile. Same. Which that kind of surprised me, actually. Quite honestly, I thought we were going to make a little. Some people please don't be depressed if you were looking to go up. Some people went up, some people went down, but remarkably, the numbers overall kind of stayed at the same level. So our focus, though, does need to be in employee engagement. If we're going to have the best outcomes, what do we have to have? Best team. I do believe we have the best team. That quality and safety scores wouldn't be there if we didn't. The question is, how do we get them engaged so that those other columns can start lining up? I can't have a good conversation about service if we don't have that rabid level of engagement. So how do we actually do that? I go back to the old stuff. Again, what's in the middle? People, exactly. There's a process we have to do all the things that we want to do. And I won't put anyone on the spot, but sometimes I think we fall back from some of the things that we maybe should be doing when it comes to rounding, one-on-ones, those types of things. And that's where we need to go. So what's ahead, you ask? Quite honestly, it's reinvesting in our work to support the team. Okay, that's where I want to make sure we start from a change perspective, is getting back to some of the basics. I'm a big fan of this picture. I'm a big fan of the saying, like a water over rocks, because sometimes people will like challenge us to say it can't be done, right? What happens with the water over rocks? Eventually it breaks through, it goes around, it goes underneath, but it works. And we have to keep doing it until we get through. Until we have that breakthrough moment, we have to be the water over rocks, essentially, to say, we want to be doing this better, okay? And I know it's hard. It's hard for us, trust me. We were having conversations about rounding a couple months ago and stuff, and it's like everything in the world seems to get in the way, right? So we started making more of a commitment. We got to start doing it. We just started taking some of the exec team meeting time and doing it, and we started doing it a little bit under the radar until someone called us out on it and said, "Oh, I see you're rounding again." And but it is getting back to those basics. We have a system to help us have world-class performance. We just don't always use it as much as we should be. And for some folks in the room, Mickey Griffin does, I can tell you that. The outcomes are world-class already. So I'm not saying it's not, and everybody here in the room has days of world-class performance. I can tell you that for sure, because we hear the stories, right? But there's also days when we know it didn't quite go as well. And that's the stuff we have to work with. We have a process to do it, and really it's getting back to those basics. Now I'm going to say getting back to basics with one exception, right? And don't scream at me because I'm adding something. The little 2-year-old came back again. Like the bottom of the house, I think we need to reinvest in the top of the house, our mission, vision, and values. Okay, so if you think about it, we've talked about mission, right? Talked about vision at this point in time. We did redo our values, okay? And I know the people department is in the process of working with the marketing people to say, how do we change these things so that we can, sorry, I should advance the slide so you can see, reinvest in our values. Because really, that's got to be the fabric of what we do. It's the respect, the service, the honesty, the safety, the accountability, and the compassion that our team needs to have. So that process, as we reinvest in, quite honestly, the day-to-day stuff we need to be doing, we need to reinvest in the top of the house. Maybe we get at the outcomes from both ends. The mission, the vision, the values. How are we respecting each other, our team members? What's our service I statements look like? Providing exceptional service. The honesty, the safety, the accountability. Are we holding each other accountable for performance? Are we holding ourselves accountable for performance? Who's an internal customer of another department here in this hospital? Everyone should raise their hand, by the way. It's a trick question. We're all internal customers. Are we holding each other accountable for service, for handoffs, whatever it might be, for movement? That's really what we need to be doing more of. Now, I promised you there's one exception. We are adding something, and we're adding it as a part of kind of closing out, not really closing out. Remember the Ritz thing? That's how we got this, right? Who was here when we did the Ritz thing, did all the sessions and all that kind of stuff? We had some new people who weren't, but this is the outcome of it, really something for Peninsula. One thing we didn't do when they came in was we didn't do an employee promise. We weren't ready, quite honestly. We weren't ready to commit, perhaps, and as an organization and as leaders raise the bar. We decided that, you know what, we need to do that, perhaps to put a little bit, perhaps because I think the environment's a little bit better now. When we round, actually, I think we're a little more stable, knock on wood, staffing's better, it's a little bit better of an environment. But I think the other advantage to now adding our employee promise to this equation is it really puts us in a position of a sense of obligation, for lack of a better word. Really saying to our team members, we're committed to you. And in exchange for that commitment to you, we have certain expectations from a performance perspective. So we had a group of folks get together recently and come up with our employee promise. So I want to share that with you. Who was involved in that in this room? Ooh, the hands go up. It's like the little secret society. So they didn't want to raise their hands at first. Oh, I hope they like it. That's what they're probably thinking, right? So our employee promise. At Peninsula Regional, our team is the heart of all we do. I say it in orientation, Stop reading ahead. I say in orientation, we are a system of people taking care of people. And that's no matter how you slice it with the CT scanner, no matter how you do whatever you do, we are people taking care of people. And that's the first statement of our promise. We promise, we as leaders, as an organization, I promise to all of you, you in turn promise to all of your team, but as an organization, as the commitment of the organization to our team, that we'll stay true to our values. Right? I talked about them, respect, caring, all that. And by doing so, what are we going to provide to our team? It's a supportive environment. It's empowering. That values integrity, doing the right thing. Diversity. Diversity perhaps in person, but also diversity in thoughts and ideas, right? Because doesn't that make us better? And sometimes don't we need that to be better, is those different ideas? Don't they contribute to an environment of continuous improvement and ultimately growth as an individual? That's what we want to see with our employees. We've been talking more and more about this at orientation. It's a wonderful thing when you can come here as doing this and end up doing this in our organization. We want to see that, and that's what we should be committing to our team. Because in exchange for helping people grow, we have a relationship with them that also allows us to provide what we need to. And then finally, your voice, i.e. the team's voice, is our voice, because that's really what it is. We are our employees. We are our team. Our organization is our team. So that's our promise. At Peninsula Regional, our team is at the heart of all we do. We promise you we'll stay true to our core values, and by doing so, provide a supportive, empowering environment that values integrity, diversity, continuous improvement, and growth. Your voice is our voice. That's coming out January 1st. You guys have a little bit of a precursor to it. So what do you think of it? Good? Awesome. To the folks on the team, I do think they liked it, so please feel good about it. But again, why do we do that? I think it's part of an equation, okay? It's part of the top of the house. Quite honestly, Deb, we got to change the top of the house. We need to put employee promise up there, and we'll move something around. But really, if we're going to come at this from both angles, the foundational stuff that we do on the bottom, right? The rounding, the one-on-ones, the process improvement, we also need to be coming at it from the top. What's our culture say? And really, from an employee perspective, what's our commitment to them in helping us get through this process? Mitzi's been leading this effort to kind of round this out, and then come January, we'll have something new. I don't know what it's going to look like. Marketing's trying to brainstorm all this stuff, but that's when we'll roll this out. And again, we just didn't think it was the right time a couple years ago when we did the Ritz to kind of do it at that point in time, but I'm doing it for two reasons at this point. I felt good about doing it for two reasons. I think we're in a better place. Maybe our scores might not reflect it, but I do think we're in a better place. Plus, I think we just set the bar. What is our commitment to our team? That allows us to have a relationship with them. That, again, we want to help them grow and develop, but we also want to have great outcomes here in what we do each and every day. So more to come on that, but you guys just got the first sneak peek. So our next steps, okay? Quite honestly, I don't want to be the water over the rocks, okay? I want to see us be a waterfall, quite frankly. I think this is Niagara, but I'm not sure. Really, we can't take years to go through this process. We've got to recommit to what we do each and every day so that we are that world-class organization, okay? I do think it's crucially important, especially in the next several years, as we go to try to transform this institution from 100 East Carroll Street to what is that regional healthcare system. And I think these are the ways to do it. So I'm going to stop there, let you contemplate that, because it's deep. I get it. It's a reflection of the fact that, yeah, we're great. We're really good. But what do we want to be? We want to be great. And we can be. We are a great organization, but we want to do it all the time, not just most of the time, or have, good things happen. We need it happening all the time. So with that, the good news is I didn't take 45 minutes. So it was a quick 15-minute little snippet, okay? And Roger, he left. What's that? Okay, so what we're going to do now is we are going to go into our next section with our discussion on change, because this is a little bit of change, you might say. And sometimes we need to think about how we do change, even though we're changing back to something we really should be doing. So